Hello, everybody. Welcome to this episode of our video podcast. Today we have a very important topic. It is orthodontics, normally known as braces. And today I have an orthodontist, specialist that does strictly that. And his name, Dr. David McIntosh. And I got to tell you, I get more questions about braces than anything else. I got to tell you a story. My brother has a child, a daughter due in 3 months. His wife called me and wanted to know if her daughter is going to need braces. And I said, I just can't even explain. It's just a little bit too soon. So, big question I get a lot from parents. When I meet parents, they say, well, how do I know and when do I need to take my kid to an orthodontist? So, Dr. McIntosh, start us off with this highlight question, please.
Sure, it's a common question. Parents worry about that a lot, and generally, the family would first hear, maybe their family dentist or restorative dentist would see that patient at their regular checkups and say, hey, I see some crowding here, this bite doesn't look quite right, maybe it's time to see the orthodontist. That would be typically the first exposure that they have to talking about an orthodontic checkup. Sometimes a parent will look, these teeth just don't look right, there are lots of spaces in here, I'm worried about it. Sometimes parents just on their own will call and schedule an appointment for their 6, 7, 8-year-old, and that's fine too. Most of the time, most orthodontic treatment can wait until most all the permanent teeth are in. Certain types of bites are a real skeletal problem, meaning an upper jaw too big for the lower jaw too big for the upper jaw, or a crossbite, which means upper teeth fitting inside lower teeth. Those kind of things. Those are things. Sorry, can you hear the dogs barking?
I think he needs braces. I think he's wanting braces.
Right.
He even wants braces. Everyone wants braces. That's okay.
Why are the dogs mouths?
Okay.
So those cross bites and those kind of things are something that we do some treatment early to correct for. But most things can wait until the permanent teeth are in and a single phase of braces versus 2 phases. 2 phases being when a patient is 6, 7, 8, 9 years old, where we do a bite correction early, maybe about a year's worth of treatment, then go into a waiting phase while the rest of the permanent teeth are up, and then go back into braces, middle school year, sometime that 12, 13-year-old range of time. But most things can wait until most of the teeth are in, but we see a lot of young patients just to reassure a parent or the patient too that this is normal right now. Space between the front teeth, that's okay. Let the other teeth come in. So we see many patients just to review those things.
So just as a take home, I'm a parent watching this video. As early as 6 or 7, they can come see you to make sure there's no major, as you said, cross bites and skeletal problems. And I know we know this, but major issues that need to be addressed early. But the vast majority, and I do agree because I see a lot of the cases that you treat, the vast majority, let's say, what out of 100 patients, how many are able to be seen in one phase, on just as an average, if you would guess?
I would say 90%.
Oh, wow. So 9 out of 10 times, you're just monitoring them at 6 years old, making sure development is okay, and you're kind of just maybe seeing them once a year or something like that?
Sometimes we may recommend having some primary or baby teeth removed a little bit early that may facilitate the eruption of some of the permanent teeth. That would be not an unusual thing, no treatment, but referring that patient back to the restorative dentist that maybe have some primary baby teeth removed.
Okay, and
that's what we're really watching for.
And then in their early teens, I think now it's called tweens or something, 12, 13, is that when you're...
That's probably the most common time doing it, or grade-wise, 6th, 7th, 8th grade, those middle school years in there, those are the time that most of those patients that need braces are having done at that time.
Good. And, I do remember I got my braces when I was summer before 9th grade, and I think I got them off a week before graduation from high school. I had 4 full years. What are you seeing cases on a typical, again, 9 out of 10 children? How long are they in braces?
Yeah, sure. Today, the typical time in braces is maybe 15 to 18 months would be an average time for an adolescent to have braces today. The braces and wires work more effectively, more efficiently, lighter forces, that the teeth respond to movement better than when I had braces, maybe when you had braces when you were younger.
Yeah.
I had braces for at least 3 years at that time, but it's very rare to have braces on that long with the present appliances and wires that we use.
So now, again, as a parent, I'm watching this video, and so you progress through. Let's say 14, 15 comes around. Are you still able in that same amount, in that same general time frame, 15 months, 12 to 15 months, seeing their kids? What if you see a kid who's 18 years old, and for one reason or another?
Yeah, sure. And 18, patients are pretty much done growing by that time. And the adolescent years, 12, 13, 11, 12, 13, the face is still growing more. We can shape that a little bit in correcting bite discrepancies. Overbites or underbites are a little more predictable in correcting and growing patients. And that's why it's a good time to do it then too, especially for bite corrections. Mm-hmm. And a non-growing patient, an 18-year-old, they're pretty well done growing. So we really are left to just moving teeth around. We can't guide the growth a little bit, which can be done in the earlier years of facial growth.
Sure. So treatment might take a little longer as a 20-year-old.
Longer, yes. It could have some other components to it, but yes.
Yeah, I do remember early on I had to expand my upper arch. I had a little palatal expander, and those are things that I think at 18 are no longer an option for you.
That's right. You can't really do that when you're non-growing 18-year-olds. They don't work for them.
Yeah,
they
sure.
Don't expand. Yes, that's right.
So now let's go to the other end of the spectrum. I have a lot of adult patients, and for me, I like when teeth are straight because they're easier to clean, less susceptible to cavities and other problems. But a typical patient for me says, "Boy, I'm too old. Can I even get braces? I'm 55, and my kids have braces. Can I get braces?" So I know that not to be true, but tell everybody what if there's an adult watching this video.
Sure. So more than half of our patients are adults, meaning over 18. We got from 18 to in their 80s that have orthodontic care. So braces, Invisalign is the other system that we use. A lot of is an alternative to braces that creates straight teeth and helps bites like braces do. There's some limitations with it, which we can talk about. But adults, the teeth move like they do in kids. We have to go slower a little bit sometimes. There's sometimes adults have crowns on their teeth. But all those things we work around and make it work very well for adults. So many adults are concerned about it, but they can wear braces very well. And Invisalign treatment is, as I said, the alternative to that, which is a clear aligner system that each aligner moves the teeth a little bit. And you wear those aligners most of the time, 20 hours a day, and they ease the teeth along, moving teeth, putting light pressure on the teeth like braces do. And that's a little bit, it's definitely more patient-friendly to adults if that can be done. They can take them out to brush, take them out when they have a meeting to go out to dinner, or those kind of things. So they work very well. It takes a lot of cooperation. You've got to commit to wearing them for about 20 hours a day, but they work very well. Sure.
So if you're compliant, certainly from a social perspective, I could see how adults would rather Invisalign. So that is another question, Invisalign versus regular braces. I mean, what's kind of the bottom line there?
Invisalign is a great alternative to braces, and most patients, a real bite correction or some more complicated treatment with a patient would need braces on to do. We can't do everything we can with Invisalign that we can with braces, but the majority of adults can be treated with Invisalign. A patient that needs teeth removed or extraction, sometimes it's a little more difficult to get the teeth fixed with Invisalign versus braces. So we give patients options and talk about whether limitations with Invisalign. But it's a great system, and we can get the teeth really have nice results with it.
So kids in Invisalign, can a 13-year-old get Invisalign?
They can. We're very reliant on the patient wearing the aligner, wearing these aligners 20 hours a day. And sometimes parents have a little bit more of a concern of that than I do or the patient does. So I said, well, if I have the braces on, I know they're on the teeth and they're going to be working great. If we do Invisalign, we're really reliant on the patient, your son or daughter, to wear these aligners like we prescribe in order for them to work. If you don't wear them the prescribed number of hours, things don't progress.
Yeah, I think back when I was 13, I probably would have lost it before I left your office. So another something I just saw on a highway. We were driving down and we see a big billboard that says "Fast Braces." There's two areas here that I want to ask you about, both pertaining to fast braces and then the system Excelident. So, and what is fast braces, Is it different? Are they using any special potions or anything like that? What, fast braces, 6 months braces. I've seen different advertisements. What does a public need to know about that? Is that something that you do, or is that not something you can do?
We do every day. We do fast braces, But what really fast braces is a system, a company that sets it up for a restorative or family dentist to do some limited braces, really straightening the front teeth. They'll set them up with, here, put these braces on this way and let this work. It's great, and it fixes the front teeth, but it's not for correcting bite relationships or getting the back teeth to fit together correctly.
Okay.
With orthodontists are very attuned to making things fit together, function correctly.
Sure.
Fast braces are something really for the cosmetic benefit of just fixing the front teeth.
Sure.
We would like to do everything to make it all treatment go faster. Can we can we do this to make you be in braces less time, which is great. And certainly in 6 months you can make the upper front teeth look pretty straight, but you can't always fix bite relationships and those kind of times. An average time is more than 6 months today. But fast braces is just a kind of an eye-catching advertisement. Look at this. This sounds great, and it can make things look better in 6 months, but you can't always fix what we feel is important. Getting bite relationships, back teeth together correctly.
But
go ahead.
Oh no, so again, the take home for this fast braces, or if again I'm an adult out watching this video, seeing this is it's somewhat marketing, nothing particularly special or new about it, nothing, and
Sure.
An orthodontist can do that, and just if an adult came to you and said, I just want to straighten these 2 front teeth out for whatever reason, it's not something you can't do. Most orthodontists out there locally, wherever you are, can handle that. So I just didn't know if it was some special new thing.
It's nothing special. It's just marketing, advertising program.
And you were just going to get into, I had recently a patient going into Invisalign, and he pulled up his iPhone or iPad, and he showed me this thing called Excelident. And, I reached out to the company to find out more information. Have not heard back from them, but that's either here or there. And it was a device that he was going to wear with his Invisalign. I don't know. I think you'd probably know if it costs more or whatnot. I do believe it costs more. Anyway, just let you take it over. What is Excelident system? What do people need to know about that?
Yeah, Excelident it's a dental device that you bite on, and it vibrates or sends these pulses to the teeth and vibrates the teeth, and it may make the teeth more responsive to the forces of braces or Invisalign that's putting on those teeth. It may make them move faster. It's something that it sounds great and it may very well work, but it really hasn't been shown in refereed journals with studies that show that this is accurately happening. It's a device you put in for about 20 minutes, you bite on it, it jiggles or vibrates and sends these impulses to the teeth and just moves them a little bit. And that may make the teeth, the bone cells and things respond around it to move the teeth a little bit quicker. But it hasn't been clearly shown that it works like they have advertised it to do. It adds about $1,000. That's just flat cost of that device. So it's a significant addition to the cost of braces or Invisalign, and it really hasn't been shown that it's truly doing those things. If it would, that'd be great. We would like to offer that up as an option, but until it's shown to be accurately as it's depicted to do these things, we're not pushing to recommending it for patients.
Well, it's $1,000, and so and you said 20 minutes. You wear this thing for 20 minutes a day.
Yeah, it's a 20-minute at a time, and during certain intervals during the day, you just use this for about 20 minutes, and it may stimulate the teeth to move a little bit sooner or quicker than they would if it wasn't there. But that's the idea behind it.
Sure. Yeah. So here we are, October 2014, just to date the video, and it sounds like the take home here for an adult or anybody considering the Excelident system is there is some preliminary studies. It's still kind of early, just like anything else. New science comes out, it's kind of early. But again, as an orthodontist, whether here in Florida or anywhere, most orthodontists are going to stay tuned to the research, and it's a fair question to say, well, where is it? How do you feel about it? And ultimately, a patient can say.
But we hope it ends up being a valid, usable tool in our.
Sure, I think It sounds like people are always trying to get in and out of braces in relatively shorter time. For me, it was 4 years, 3 years. Now it's 15 months. You know, I did hear a rumor, and I got to ask you, you're a Florida State graduate, Florida State fan.
Yes.
And so this is kind of the ultimate. I heard that if both your parents graduated from Florida State, that you naturally, as a child of 2 Florida State graduates, never need braces because your teeth always come in perfectly straight 100% of the time.
There you go. I understand that to be true as well.
Well, you know, that just cuts your time down to 0. So you don't need any of this. You just need to make sure both your parents went to Florida State and graduated from there.
Don't even need to call. Don't even need to check.
Well, gee, I mean, Florida State's on top of the heap. You had Heisman Trophy winner. Looks like they could very well repeat as a national champion this year, 2014-2015 season. So you guys are on top of it.
Keep the players out of trouble. That's the main thing. Let's keep them
on the field.
On the field only.
Yes.
Yes.
Well, listen, Dr. McIntosh, I really appreciate it. For any of you watching this video, please, we have comments at the bottom here. Please feel free to ask questions, comments. We will do our best to answer and do what we can to help out. We're trying to get some videos out there for the public to watch to try clarify as many questions we all have. And Dr. McIntosh, I appreciate your time, and thank you so much.